Okay, it's 9 o'clock, and we'd like to welcome Julian Thompson. He is a lecturer at the Department of Theology for students at Newbold College, and we're very happy to have him today. His topic is going to be pandemics and public health in ancient Israel. Sounds very interesting. Over to you, Julian.
Thank you. Let me just share my screen with you, and then we will be away. Okay, there we are. Thank you very much for inviting me to share with you this morning. The subject is pandemics and public health in ancient Israel. What did Moses do? And, I'm sure like many of you have been thinking and considering, do we find any wisdom in the biblical text for such extraordinary circumstances as we find ourselves in presently with the COVID pandemic? And with this in mind, this is the topic that I settled on. So I do hope that it will be interesting, informative, and also hopefully encouraging. Let's bow our heads for a word of prayer. Lord, as we turn to your word for wisdom, we ask, Lord, that you will give us understanding, not only of what your word says, but also how to apply it in our present context today. This we ask in Jesus' name, amen. On the 17th of April of this year, we passed a very grim waymark in the COVID pandemic. We hit that figure of 3 million. 3 million. And I remember on April, sort of listening to the different news reporters, just reflecting on the fact that so many people have now died of this pandemic that has been with us for, well, over a year now. And one of the things that has been playing on my mind, as probably it's been playing on your mind as well, is the fact that, particularly for those of us who are working in a religious context within local churches and with fellow Christians and believers, is the fact that sometimes we find that individuals' responses towards COVID is the result of certain theological views and beliefs. There have been prominent examples of Christians, believers, who, as a result of theological opinions and views that they have perhaps not taken COVID as seriously. And so as individuals who also wrestle with theology, we're in a very real situation in that we've seen firsthand that theology can actually kill. Some of the views you may have heard and some of the views I've heard, I've listed here for you. Denial. Perhaps based on a particular belief, perhaps in end time events or something else. Individuals have expressed the opinion COVID doesn't exist. It is a deception. Some perhaps have opted to spiritualize COVID with maybe a slightly blasé, God will protect me because I have faith. Or perhaps some of the views that you've heard may be based on a misinterpretation or perhaps a misunderstanding of prophecy. I know questions have been asked in relation to, is the vaccine the mark of the beast, for example? And as a church, as individuals who care for our Christians, we care for our members. Sometimes it's challenging in terms of how to respond to some of these dynamics that arise. One of the words that has entered our vocabulary recently or one of the terms rather, is public health. Now, public health, if you were to define it, you'd say it's the art and science of preventing disease, prolonging life, promoting health through the organized efforts of society. In response to this current pandemic, governments, charities, agencies, churches, religious organizations have mobilized in order to put or implement policies and practices in order to try to help to keep the pandemic at bay and keep us safe. In the UK, one of the dynamics that has, one of the messages that we have had shown to us quite often is this: stay home, protect the NHS, and save lives. And undoubtedly, many of you in your context have received similar messages from your governments. Now, as we wrestle with the question as to, what might the Bible have to say about some of these things, it probably wouldn't surprise you to note that, well, perhaps concepts such as pandemics, public health, might be a little bit difficult to find. If I went to my Hebrew lexicon, I don't know that I would find the term public health, or perhaps even pandemic. And so as we start to look to the Bible to try and see, is there some wisdom that we can gain from it in relation to our present circumstances? It's important to be careful about how we read the text and that we don't sort of impose our modern ideas on it. Some of the questions that I cycled through as I found myself coming to approach this subject within the passage. Do comparable public health initiatives exist in the Bible? How did ancient Israel deal with outbreaks of contagious disease? But the question that I settled on was, did the concept of contagions actually exist in ancient Israel? And with this as a springboard, I came across a number of interesting things. Now, what is a contagion? A contagion is basically the communication of disease from body to body by contact, direct or mediate. So the idea of a contagion is something that can be passed on from one person to another, or perhaps from an object to a person. It might seem self-explanatory for us today, but the truth is that in the ancient world, many of the cultures had different ideas as to what constituted disease and illness. It's interesting to note, for example, that in ancient Egypt, there's no textual evidence to suggest that the concept of contagion existed. But in Mesopotamia, we do find numerous examples in texts such as those on the Mari tablet. In pre-Islamic Arabia, the tribal traditions viewed disease as being caused by demons and evil spirits. And in Greek and Roman nosologies, they subscribed to a theory of disease that was based more on the idea that one got disease from sort of a poisonous atmosphere rather than another person or individual. Now, as we come a little closer to the Hebrew text itself, undoubtedly one of the questions that must be in your mind surrounds leprosy. Is it possible that the Hebrew Bible considered leprosy to be a form of contagion? And this is an excellent question. Now, why did I title this presentation, What Did Moses Do? Well, when you look at the structure of Leviticus, many of these laws and statutes and ordinances are framed as God speaking to Moses, or God speaking to Moses and Aaron and saying. And so in a very real sense, we get an idea, we get an impression as to perhaps, well, not perhaps, but we get an understanding as to the types of laws that, and the types of guidelines that were put in place in ancient Israel. And as part of that, we have a very interesting passage in Leviticus 14. You can also include Leviticus 13 and 15 in this, but you have this very interesting passages that talk about lepers. So take a look at this text here. All who enter the house while it is shut up shall be unclean until the evening. And all who sleep in the house shall wash their clothes, and all who eat in the house shall wash their clothes. It's speaking about a scenario where leprosy is present. And what you can see in this text, or what it seems to be suggesting, is that by being in an environment where leprosy is, one becomes unclean. And the scholar Leiber says that the only inference of contagious disease in the modern sense that we find in the Hebrew Bible is located in this passage. So basically, what he suggests is that if there's anywhere in the Hebrew Bible that seems to suggest the idea of a contagious disease or a contagion, it is here in Leviticus chapter 14, verses 46 to 47. When you have a look at the law of the leper itself, and you have a look at various aspects of laws to do with leprosy in Leviticus, we find a number of interesting things. We find that it lists various symptoms and also how to diagnose them. We also find an interesting passage in Leviticus 13:45, which even says that those who have leprosy are to identify themselves by wearing, how could I put it? Sort of raggedy clothes, and by proclaiming that they are lepers. Perhaps wouldn't recommend the same thing if you've got COVID today. In addition, and what's also quite interesting, is that you also find within there various quarantine procedures. Those who were identified as having leprosy would be quarantined in their homes, or they would be asked to quarantine outside of the house. And it gives various stipulations as to how this process worked. It's also interesting that you also find principles to do with cleansing and how to re-enter the community. There are texts that speak about clothes that may have been infected by leprosy. There are texts that speak about walls or houses that may be affected by leprosy as well. And so what's actually happened with Leviticus is that a number of scholars and doctors have looked at this passage and wondered, do we see sort of the beginnings of a public health policy in the Bible? One scholar, Alfonso Fernandez Vasquez, says that the sanitary code has aroused deep fascination among experts in modern preventative medicine. And the biblical scholar Wellham suggests, to use a modern analogy, the priest in ancient Israel was more like a public health inspector than a physician. That's in the case of the matter of leprosy in Leviticus. He determined whether a person was infected, and he did not attempt to cure him. One interesting case is that of Balavignus, who was actually a Jewish physician, and he was alive during the time of the Black Death. And there are records that suggest that in 1348, he ordered or instructed the Jewish people in his community to actually follow the biblical laws of Leviticus and reduce the amount of Black Death victims to only 5% in his community. Interesting, isn't it? And so we're zooming in here on leprosy. And there are a number of examples of leprosy in the Old Testament. Moses, Miriam, King Uzziah, and Naaman. These are all examples of people who are described as having had leprosy at one point or another. And now, oftentimes when we read the word leprosy in the Bible, we tend to read leprosy in terms of the modern understanding of leprosy, which is Hansen's disease. And the symptoms include discolored patches of skin, growth nodules on the skin, thick, stiff, or dry skin, painless ulcers on the soles of the feet, painless swelling or lumps, loss of eyebrows or eyelashes. And if you type in leprosy in Google, you'll find pictures of the effects that this awful condition can have. But what some of you may be surprised to know is that the leprosy spoken of in Leviticus is not actually Hansen's disease. And we know this for a number of reasons. The symptoms don't actually match. So we've had scholars and doctors who have done a medical exegesis of the passages that mention leprosy, that mention the symptoms, and they've discovered that actually they seem to be talking about different things. The scholars aren't actually certain as to exactly what it is that the Bible is referring to when it mentions leprosy. Some wonder, is it maybe a form of psoriasis? Some think it's maybe perhaps some sort of skin condition, but the truth is that we're not sure. And this is not only coming from textual evidence in the Bible itself, but this is also coming from the fact that when they've gone on archaeological digs in places such as Egypt, and they've done analysis on graves and burials that they found, there has been no evidence of Hansen's disease found BC. None. In that part of the world, that is. Then you also have the interesting case of Naaman in 2 Kings, where Naaman is described as being a leper. Yet it's interesting that he still seems to have communication with a number of individuals. And so scholars suggest that, well, perhaps, when we bring all of these things together, perhaps leprosy was not always viewed as maybe something that was caught from individuals. Perhaps certain forms of leprosy were not seen as perhaps contagious in the way that we see it. Interesting. Back to the law of the leper. And so as a result of some of these things, scholars have sort of pushed back a little bit and said, well, sure, Leviticus 14, it could be understood as suggesting something contagious, but we can't be fully certain. And so to this day, there are debates that are taking place as to, well, should we understand, or can we understand Leviticus 13 to 15 in a medical sense? I want to suggest to you that actually, whether the leprosy described in the text is medically contagious or not, that is not actually the issue. Remember at the beginning, I sort of posted a little warning about the temptation sometimes to impose our modern views and our modern readings on the text. Because you see, within the context of Leviticus, when you look at the book and how it works and what it's communicating, it becomes clear that the primary functions of the laws was actually not medical. The primary functions of the laws in Leviticus were ritual. Because you see, in the context of Leviticus, having leprosy meant that you were ritually impure. And if you were ritually impure, you were unable to participate in the worship. You are symbolically separated from God and from your community. But what I find even more interesting is that nevertheless, even though the primary functions of the laws in Leviticus 13 to 15 were not medical, faithfulness to these same laws would have still brought the community in ancient Israel enhanced protection from disease. You see, sometimes God may ask us to be faithful in a particular area of our life, and we may not even be cognizant of the blessings that is bestowing on us. You see, faithfulness within this context, within ancient Israel, faithfulness to the laws such as Leviticus 13 to 15, reinforced an understanding of who God was. These laws in Leviticus, they reinforced the idea of God's holiness, his awesomeness. And so faithfulness to these laws reinforced an understanding of who God was, as well as one's responsibility towards the wider community. Because you see, if you had leprosy, however we understand the term leprosy, you could get in the way of somebody else's connection with God. You could make them ritually impure. Excuse me. Faithfulness. So somebody might be asking, well, what are you saying, Julian? Are you saying that we need to take the laws in Leviticus 13 and beyond and apply them in a very literal way? Are you saying that if I'm a leper, or maybe if we update it to present times, are you saying that if I have COVID, I need to dress in a particular way or I need to shout out? No, that's not what I'm saying. What I'm saying is that we need to look at texts like Leviticus and ask new questions. You see, the text of Leviticus was written at a time when ancient Israel were faced with the question as to how do we express faithfulness to God in the face of conditions like leprosy. We today need to ask questions about how we express our faithfulness to God in 2021 in a time of COVID. And this is one of the challenges that I've had with some of the things that I have heard. Does faithfulness in a time of COVID really look like this? You see, I would suggest that if our answer to this question is yes, we need to think much, much more deeply. And in thinking deeply, we also see that we are on the verge of facing opportunities. You see, in the same way that faithfulness in Leviticus reinforced a depth of understanding as to who God was and reinforced ideas of responsibilities to ancient Israel's wider community, our faithfulness today should lead us to have a deeper understanding as to who God is, and should also lead us to think deeply about how in these times, in these circumstances, we can demonstrate and express responsibility and love to the communities that are around us. Faithfulness today might look like conscientiousness. If I have a fever, if I have a cough, if I have any symptoms, do you know what? I'm not going to put myself in a place where I could pass those on to others. As governments, authorities struggle with how to address deep issues and genuine concerns about things like vaccines and things like how to respond to vaccine hesitancy. As churches, we are in a position to partner, and some have, to partner with health services for the betterment of our communities and our churches and our members. One of the things that COVID has revealed to us is the fact of health inequalities. Why is it that just because you have less money than somebody else, there are times when, due to a lack of finance, your health outcome will be worse than somebody more well off? Can we respond to these issues as God's people? We've seen issues of social justice. Can we respond to these issues, these opportunities that present themselves to us, to connect with those in the world around us, and for people to say, this is a community who cares beyond its walls? Sustainability. Can we, with our respect for God as the creator, do we have a voice? Are there things that we can share about respect for the world that God has created? You see, I would like to suggest to you that in a very real way, theology can save lives. COVID has presented various challenges and difficulties. And I believe that we can be a part of the solution.